Hello, YouTubers, friends, compatriots. Blue shows Nestle stars, peasants, vassals. I'm a useful idiot. In my last video, I talked about pharmaceuticals and how pharmaceuticals undermine the healthcare system. And today, I want to do a discussion about war and drugs and how pharmaceutical companies are involved with the U.S. military. And we see a lot of the same pitfalls we see in the civilian healthcare system transferred over to the military healthcare system, and as you would suspect, there's a lot of peculiarities to the American Military Association with pharmaceutical companies and their healthcare system. But we'll get into that. So today's story is about a new study about the relationship between the Department of Defense and pharmaceutical companies, and for the first time, they've looked at the amount of money that the Department of Defense spends on pharmaceuticals and where that money goes to. And as everywhere else, there's a skyrocketing pharmaceutical budget. Just last year, 2011, the Pentagon spent more on pills, injections, and vaccines than it did on helicopters, tanks, cargo planes, and missiles combined. And drug spending is up 123% since 2002. So since the war on terror started, the drug spending bill is up 123%. And since 2002, the Department of Defense has spent more than $5 billion just on Lipitor, Plavix, Advair, Nexium, and Singulair. Overall spending is about $3 to $7 billion. And it's hard to really actually even figure out a total because all these numbers add up so quickly when you spread them out over all the different pharmaceutical companies. So, of course, as you would imagine, the entire industry is getting in on this feeding frenzy. And one of the travesties is that rather than drugs needed to treat battle wounded, the top selling prescriptions are for aging retirees covered through TRICARE, with drugs for arthritis, osteoporosis, and diabetes. So just like the general population, we see an aging population, a retiring population, a wounded and chronic problems population that is going to continue to sap the healthcare system of the military as they age, and especially as we have more and more wounded from all these theaters of war. And oddly, the last 10 years, $380 million has been spent on erectile dysfunction drugs, and $238 million has been spent on testosterone therapy. And overall, active duty only accounts for 10% of pharmaceuticals, so that is not surprising. So 90% of pharmaceuticals are basically going for non-combat and for aging military who are eligible under this TRICARE system. Now, up until 2000, a lot of the retirees were moved into the Medicare system, but they set up a health system called TRICARE in 2000 that increased the occurrence of paying for drugs purchased at retail. And so instead of going through the VA or email and getting the drugs cheaper, of course, when you set up this insurance company or set up this government healthcare system to take care of the military, once again, we find that moral hazard where there's no reason for prices not to go up as long as you set up a system like that. And that's what the militaries find out. They set up TRICARE, and now they find their budget skyrocketing because once again everything's moved into the private market and private purchasing, and of course since the advent of all these wars, this program TRICARE has been expanded to include National Guard and Reserve as well. So it's expanded very rapidly in the last 10 years, and so that's another reason why we see this. And just like I mentioned in the previous video, one of the problems is that high-priced specialty drugs are driving up the total cost. So, and that's what we discussed in my last video, one of the heart of the problem with pharmaceutical companies, and that is certainly the case with their involvement with our U.S. military as well. High-priced specialty drugs drive up the cost of everything. And a good example of that is a company called Novo Nordisk, who was even indicted for product fraud for a drug that cost $10,000 a dose. And so there we see those extravagant costs once again. But in this case, of course, it's hardly an orphan drug that has a specialized market. And in fact, Nordisk sales to the military was $475 million between 2002 and 2011, and continues to this day. And just like a lot of other corporate involvement with the U.S. military overseas, we see the government defrauded by these companies. Novo Nordisk was certainly indicted for fraud, and yet they continue to have U.S. military contracts overseas, as well as all the other companies. Most of the other companies, including AstraZeneca and Pfizer, have also been indicted for various kinds of fraud, and yet we continue to have contracts with them, just like all the other companies, corporations that are working in Afghanistan and Iraq. So anyway, the dark side of this whole relationship with the U.S. military and pharmaceuticals is that we have a fighting force that is increasingly reliant on antidepressants, psychotropic drugs, and narcotic painkillers. And in the last 10 years, $2.7 billion has been spent on antidepressants for the United States military. $1.6 billion has been spent on painkillers like OxyContin for the U.S. military. $507 million over the last 10 years on sleeping pills for the U.S. military. So this is somewhat a reflection of trends, certainly in the civilian population, but in actuality, this even outstrips the pace in the civilian population. No surprise there. And of course, pharmaceutical company profits from the military have soared in this era of all these big wars, the big winner being Pfizer. They've had $8 billion in sales to the military just since 2002, so the war on terror has been very good for them. Abbott Company sales are up 300%. Novartis, they've doubled their $400 million they made last year in 2011, and so here we go. Once again, corporations, not exactly patriotic, certainly profiting off the misery of America's youth overseas, and defrauding our government, defrauding our military, and so it goes. We see this over and over and over again. Why would pharmaceutical companies be any different? And interestingly, though, the military is only 2% of pharmaceutical sales overall. So all that said, and all these big numbers I threw around, that's only 2% of pharmaceutical sales, but pharmaceutical companies really value this association with the military because it's good for long-term investment. Needless to say, there's a huge healthcare system in the military, and a lot of these doctors will go in and out of private practice and also add a lot of credibility to the pharmaceutical industry by using and endorsing particular drugs. So, just like the private sector, between 1998 and 2000, the pharmaceutical industry spent $2 million for 1,400 trips for doctors to places like Paris, Las Vegas, and New Orleans. So those doctors are wined and dined, just like the ones in the private sector, to get them to favor whatever drugs they're marketing. And once again, who knows how much of this stuff works and how much it doesn't, and how much is misprescribed just because a bigger market needs to be created by these pharmaceutical companies. And that's a lot of times one of the lawsuits are because of the fact that they're not having enough sales of the drug, and so they will reconfigure it to supposedly address some other maladies. And 9 times out of 10, it's found out that it didn't really, it really wasn't an effective drug and actually caused more problems. And that's where a lot of lawsuits resulted. So anyway, there's another interesting aspect of the pharmaceutical industry and the odd relationship between war and drugs. I'm a useful idiot. Don't you be one too.